This is Jana. Jana is checking in for her spay this morning. When you check in for a surgery, a technician will go over your paperwork. It takes about 5 minutes. We make sure that your pet has been fasted overnight and then go over kind of what to expect for the day. Every patient gets a pre-anesthetic exam, which is a complete physical exam by Dr. Lee. She looks in their eyes and their ears, listens to their heart, feels their joints. It's a complete physical exam, and that helps determine what kind of medication Jane is going to get before her spay this morning. We are getting blood for a pre-anesthetic blood work panel. Majority of our surgeries do have blood work performed at some point before the surgery, whether it's the morning of or the day before. We have the capability of getting blood work results here in-house within about 20 minutes. So that's the case this morning for Jana. We are prepping for an IV catheter here. Every patient that goes under anesthesia gets an IV catheter. It's important to have that catheter in place for quick intravenous access if needed. All of Jana's pre-medications this morning are going to go through that IV, as well as her fluids during the procedure. Lori is placing a 20 gauge IV catheter in Jana's right cephalic vein. The catheter size and placement just depends on the size of the pet and the procedure. IV catheters are usually left in place until the patient is fully recovered, and they are taken out just before discharge. This is Jana's pre-medication going through that IV. That's going to kind of take the edge off, make her a little bit sleepy and ready to be anesthetized. This is our surgery suite. Everything in this room, every piece of equipment is used on almost every patient in some form or another. There's a heated table. We are monitoring heart rate. We are monitoring SpO2, which is blood oxygenation levels. We're monitoring blood pressure as well as end-tidal CO2 and respiratory rate. Lori's getting ready to intubate here. An endotracheal tube is vital to our surgical procedure. We want to make sure that the sevoflurane gas that we're administering is going directly to the lungs, and then we also want to be able to control Jana's respiratory rate. We do a quick prep, which includes shaving and a quick scrub before we move to our surgery suite to prevent contamination. This is the equipment that you saw before being hooked up. And then this is Lori doing the final scrub here before Dr. Lee will come in and perform the spay. Everything in the surgery suite is considered sterile. There are sterile fields above the surgical pack like you see here. Dr. Lee has scrubbed and prepped her hands and then has sterile gloves on so that she can touch the equipment that was sterilized and ready for the surgery. This is the initial cut here into the abdomen to be able to remove the uterus and the 2 ovaries. The method to closing after a surgery truly just depends on the pet and the procedure. Some patients go home with external sutures that have to come out in 10 to 14 days. Most routine procedures like a spay or a neuter are closed with internal sutures and then an external glue layer. So it just depends. Jaina today will go home with a glue layer on the external skin so that her mom doesn't have to come back in 10 or 14 days. Each patient gets a cold laser therapy session. This is reducing inflammation, reducing pain, and speeding up the healing process. We recover all of our patients in a heated kennel. Their endotracheal tube is not removed until they are awake and swallowing. Lori, the technician here, will stay with Jaina until she is awake and sitting up. Jaina will be ready to go outside and use the bathroom in a few hours and goes home roughly 4 to 5 hours after her procedure. Your baby? You got your baby? Here's your baby. Good girl. Good girl. Good girl. Got your baby? Here's your baby. Good girl. Here she is. Oh, you're so